Hi, my name is Erica Palmer. I'm the Senior Veterinary Technician here at Mystic Aquarium, and welcome to another episode of Vet Tech Savvy. On a previous episode, we talked about ultrasound, and we ultrasounded a beluga whale. However, here at the aquarium, all of our animals, from big to small, all get the same health care. So here at the aquarium, we have a wide variety of animals of all different sizes, and we use ultrasound in almost all of them. So what we have in order to maintain that is actually probes of different sizes. So with a beluga whale or a large animal like our stellar sea lions or harbor seals, we have this larger probe that works well for them. However, for smaller animals like turtles, snakes, some of our newts, other amphibians, we have much smaller probes that give us great detail for little tiny animals. Ultrasound is a way for us to be able to look at soft tissues in all of our animals. So that includes our internal organs. The other things that we can see are spaces inside of joints, and we also can see the surfaces of lungs in most of our animals as well. But mostly our ultrasound is looking at our internal organs, hearts, livers, kidneys, gastrointestinal systems. Each of our pieces of equipment work differently, and they show us different parts of the animals in question. So ultrasound is showing us internal organs. A radiograph would be showing us bones and lungs. And so when we have an animal that needs our care, it's important that we have all of these different pieces of equipment to give us a complete clinical picture of that animal. All right, now that we're all set up, let's go use this in the field. All right, here we are with our patient of the day. This is one of our ball pythons, and we're gonna take a look here and see some of his internal organs. We're gonna try to see his heart, liver, some of his gastrointestinal system, and how we do that with an animal so much different than, say, a beluga whale or a sea lion. Obviously, snakes are pretty long. So everything in their body is kind of stretched out, whereas in other animals, everything's a little bit more compact. So what we'll do is we'll hold him up, and then I'll be able to use our small probe to access underneath of his belly in order to access all of his organs, and we'll get a look at how everything looks today. So we use this ultrasound gel in order to make good contact across the skin and scales of animals that we are ultrasounding. We're gonna start right up here, and we'll just come down. And it allows the sound to penetrate really nicely into the tissues. It does make our patients just a little bit slimier than normal. So here in this image, we have Calvert's heart. And so this allows us to see the chambers of his heart. We can check his heart rate, which can tell us if he is stressed or if he is having any issues there. So we can watch the blood flow, we can watch the heart contracting, and that looks really good, buddy. There's some of the goop. So now in our image, what we're seeing is the edges of his lungs. So ultrasound cannot go through the lungs, it can only see the surface. So this bright white line is actually the surface of Calvert's lungs. And we can look for irregularities in the surface of those lungs, which is one of the ways also that ultrasound is helpful, even though radiographs are usually a better way for us to evaluate the actual health of the lungs themselves. All right, so now we have a liver here. Their liver is very long. So all of this here is liver. And we scan the whole way through all of the organs that we can to get a full picture of how that organ looks. Now we can start to see his intestinal system, and we can see how much his intestinal system is moving, which is important to know how well he's digesting his food. So all of this here is intestines. So we scan the whole way down his body because his organs go from the front the whole way to the end. All right. And that completes his full body ultrasound. Now he can flip back over. We'll get you a little towel and get some of this gel off of you.